majority of women do not embrace healthy living lifestyle, not out of choice, but due to lack of awareness, time, and prioritization. It's time to change that narrative. A healthy woman is a strong woman, and a strong woman builds stronger nations. And the program is Women and Leadership on Canal the International. We'll be right back just after the jingle. And neglecting regular checks-up can have significant consequences for women, leading to delayed diagnosis, increases the risk of chronic diseases. While specific statistics may vary, studies have consistently shown that many women skip preventive health screenings due to factors such as time constraints and lack of awareness. Prioritizing family responsibility over personal health. Well, today our focus is on women health and healthy living. If you have missed our past editions, you can go to Canal, the YouTube page. You type Women and Leadership, you type the thematic of the day, and you can watch all our past editions. And let the conversation begin just after the jingle. For us to know our guests, and just like in our past editions, we always invite just the right women for the thematic of that day, so women can be able to pick out something that will change our mindset, change their lifestyle, and be able to contribute and empower our women out there. And the first guest on my left, she's called Dr. Gwet Bell. She is a Cameroonian gynecologist who supervised the first successful vitro fertilization treatments in Cameroon. She established the odyssée clinic in Douala, Cameroon, which has become one of the country's most respected gynecological medical facility. And she just recently published a book, and she's right here with us. Hello, Dr. Gwet Bell.
Hello.
How are you doing?
Well.
This is the first time I'm inviting you on the program on women.
Yeah.
Now, what are your daily motivations as a woman? Qu'est-ce que vous motive tous les jours comme femme?
Wow. D'abord Sorry, I'm going to talk in French. Ce qui me motive, c'est surtout de pouvoir développer les activités que je fais, et aussi de tirer les jeunes, particulièrement les femmes, pour pouvoir se déterminer et être le plus indépendante, disons ça, et participer à l'économie du pays.
So despite your tight schedule, you still create time to ensure that women are empowered. Tu peux nous dire un peu de ce livre qui est sur le marché, ça ne fait pas 6 mois?
Ben, dans ce livre, je décris mon parcours.
En tant que femme?
En tant que femme, ma jeunesse, depuis ma tendre jeunesse, depuis que je suis à l'école primaire, jusqu'à être ce que je suis devenue, c'est-à-dire en quittant le Cameroun, en allant en France, en retournant, et surtout en faisant des pratiques médicales de pointe, comme la fécondation in vitro.
Okay. On va parler de ça. We'll talk more about you and your contributions to the growth of women, especially when we talk about the health of women. You're welcome to the program once more. We equally have Dr. Reverend Glory BEFEKE, épouse ANYE. She is the founder of St. John's Memorial Clinic, Newtown Airport, Douala, Cameroon. She's doing a lot, but I would like her to introduce herself by herself. Welcome, Doc.
Thank you, Maureen.
How are you doing today?
Fine.
I want you to tell us more about you, because I know you're doing a lot, and you also have an institution where you're training nurses, doctors.
Yes, thank you so much. As you earlier mentioned, there is a clinic at the Newtown Airport neighborhood, just close by the airport, St. John's Memorial Clinic, where we, in our own little way, try to support the community to alleviate and to give health, especially to the women This program is talking about a healthy lifestyle for the women. There's a reason why women should actually pay particular attention to their health, because physiologically and naturally God has created us in that way to maintain the health. So we, at that neighborhood, we try to give our own little contribution to the community for a healthy lifestyle. Equally, there is St. John's Higher Institute, where we equally train some health personnel, as you earlier mentioned, and also maybe those in business and other departments. They want equally to maintain this legacy that even after us, we can have others to come and uphold it and continue to alleviate and to better the environment for a healthy living.
Now, I love what you just said. Like, you're in a neighborhood where we have, you see women suffering daily, and how there's a soft heart for making sure that women don't die because they cannot provide health care to themselves, right? That's what you do daily, and you meet women daily, you diagnose them daily in your hospital. Talk about that. We equally have EVELYN Che. She is an entrepreneur, she is a network marketer, she is a public speaker, she is holder of a bachelor's degree in management and master's degree in marketing and business communication. She is a caterer for small chops. Small chops. She talks of modern and traditional chops. Let me put it that we're talking about food here, of course. You're welcome to the program.
Thank you.
Now, how are you doing? And this is the first time I'm inviting you on the program on women and leadership to empower more women out there.
Thank you.
And tell us a little bit about you. Now, when you talk about small chops, what do you mean? What do you do exactly? And what do you do daily to empower women around you?
See, my daily activity, I own a small business, a shop, but like the catering is somehow a side hustle, let me put it that way. And many people know about it. So,
and as women, we should always have side hustles, because your job can never be enough. There are always small jobs you do to make ends meet, because you have children, you need to cater for those children. And statistics show that a lot of women are out there. 60% of women take care of their homes from what they do.
Talking about children, I'm a mother of 2 adults.
All right, thank you so much. We equally have Pastor MARYLYN Ekema. She is a nurse by profession. She is a family therapist and general counseling. She is assistant spiritual leader of March Foundation International. But what I'm interested in is to know about March Foundation. Now, what's March Foundation? What's it all about?
Okay, thank you, Maureen. March Foundation is a non-profit organization. Our headquarters happens to be in the US, but we have branches in Nigeria, Cameroon, Canada, and America. And this is a group of women that come together to help each other live a healthy life, help women against abuse, women who are going through abuse, be it in your home by children, young girls. We go as well as schools to educate young people on drugs and other substances that are being abused on a daily basis. So that's what March Foundation is.
All right, and March Foundation is celebrating 10 years. So in 10 years, you've been doing that philanthropist.
Yes,
you've been doing that charitable works on the field, educating women. You have soft spot for women.
Yes.
You have soft spot for young girls out there, because a lot of them are derailing. And
yes.
Today we are talking about healthy living, what you're doing daily. Now, I'll be telling women out there what they need to do to care for their body, to package the body and make sure that the body looks good daily, right?
Yes.
And before we get into discussing the subject of the day, I want us to watch this report, which talks about healthy living, statistics painting the situation on the ground, how it affects women, the number of women that are affected by the fact that they don't regularly check their health, they don't embrace healthy living. Let's watch. We'll be right back just after the jingle.
Across Cameroon, thousands of women are putting their lives at risk by neglecting one critical act of self-care: regular medical checkups. In many parts of the country, especially in hard-to-reach areas, checkups are rare. Women often visit health centers only when complications have already set in during childbirth or when pain becomes unbearable. Health experts say this pattern is dangerous. Preventive care, including antenatal visits, cervical screenings, and blood pressure monitoring, amongst others, help catch life-threatening conditions early. But due to insecurity, poverty, long distances, and sometimes deep-rooted misconceptions, many women continue to delay or avoid these visits altogether. Medical staff in maternal units report that some women attend just one checkup before delivery. By then, underlying conditions may go unnoticed, increasing the risk of complications and even mental health. Doctors and wellness advocates stress that self-care is not selfish, it is essential. They encourage women to treat routine checkups as a priority, not a luxury. That include screening for common cancers, following up on chronic illnesses, and addressing mental health challenges.
And welcome back. Today we are talking about women's health, healthy living lifestyle, and statistics show that a lot of women today are yet to embrace that healthy living lifestyle. But before we get to that, I would like to ask Dr. Gwet Bell, quand vous regardez la société aujourd'hui, quelle est l'observation quand vous comparez de la santé de la femme?
La santé de la femme, je pense qu'elle n'est pas encore totalement au point. On voit encore aujourd'hui des patientes qui meurent de cancer, qui auraient pu les éviter en faisant des tests en amont. On voit aussi des jeunes femmes qui continuent à demander des avortements, alors qu'il y a des family planning qui peut les aider à ne pas tomber enceinte. On voit également certaines qui n'arrivent pas à finir leur scolarité, que ce soit pour des raisons financières. Les jeunes femmes. Donc je pense qu'il y a encore beaucoup de choses à faire pour ces femmes-là. J'admire les ONG qui font ce travail de fond pour les aider à y arriver.
Dans les statistiques, ne sont pas trop bons. Quand on voit la santé de la femme, c'est un peu déplorable.
Non, il y a encore beaucoup de maladies non évitables qui continuent à tuer les femmes, l'accouchement. Les femmes continuent à mourir d'accouchement, elles continuent à mourir d'avortement, elles continuent à mourir des cancers. Donc, effectivement, c'est...
All right, Dr. Glory, is it the same views you're holding when it comes to the health of women? Now, what's your observation on the field? Because you meet women daily and you've been talking to women that come to your hospital.
Right, it's the same view. Now, on a daily basis, we receive women, we carry out some screenings, especially on their reproductive health, on the aspect of maybe cervical. She already mentioned cancer, the screening of the cervical cancer and breast. We realize that quite a handful of them visiting us, they are already into the stage pre-cancer, pre-cervical cancer. And a few of them already above that stage where they have to undergo chemotherapy, radiotherapy. There we refer. Now, it's about the awareness. It's about the prevention. If all these were taken into consideration quite early enough, maybe the female children getting vaccinated at the ages of maybe 9 to 13 with the human papillomavirus vaccine, it could have been prevented some of these cases from happening. Or early detection, where the women do some regular, maybe annually, screening, especially of the cervical cancer and breast. So it's a situation that is still very needs a lot of awareness. Also, people coming around for abortion, they come and request, just as Dr. Bell earlier highlighted. And all of this, they'll give you some funny reasons.
Thank you so much, Doc. I want to talk to Evelyn now. Have you ever been to the hospital, just your normal check, like as a woman, like let me just go to the hospital, just do my checks to see if my health, I'm okay in terms of health-wise?
Of course. Really not often, like yearly, but once in a while I do that.
Now, what's your motivation?
Just to prevent sickness that may deteriorate if it's not dictated earlier.
You do it because you have money? Or you do it because other women will say maybe they don't have the means? Or what do you think should be pushing women not to go to the hospital to do their checks?
Okay, some really don't go because they don't have the means. Some don't go because they don't even want to hear something. Some are just like naive and they don't want to hear that I have this sickness that will push me to be maybe on a medication for life or whatever. And some say when you keep it, when you don't know a sickness, it will not kill you. That's what some people say. Meanwhile, that's not the truth. There are some sickness when they are being diagnosed earlier, they can be treated, it can be controlled, and you can live longer rather than staying home and being afraid of going to check your health situation, and then by the time they know it has gone to the worst
a very
stage.
chronic stage.
It's difficult to.
Now, Marylyn, tell me, is it a problem of means?
Well, I would capitalize on the fact that the means is the main reason why healthcare is expensive in Cameroon. Abroad, they have insurances that cover for some diseases. I know that the government is trying with the universal health coverage that is covering children from 0 to 5 years. When they come into the hospital, there is at least that 15,000, and for our dialysis patients, they are being covered for their dialysis, but it's not enough. Because when people think of the fact that when I go to the hospital, I pay consultation, after the doctors, I have to go to the lab. Some of the lab tests cost like 5,000, 7,000, and then they have like 6 of them to do. And then from there, you'd have to buy medications after that, and the medications are not cheap. So when somebody thinks of that, they would go to the clandestines, like Doctor mentioned. They would try to go to over-the-counter drugs just to find something that can cool it down, instead of going to find out what is really the problem they're having or the symptoms. Why do I have these symptoms? Let the hospital tell me what I have in order to know what I can take, but we self-medicate a lot. So those are some of the reasons why we have the problems that we're having.
But now, don't you think, is that what we should be telling women? That if you don't have the means, you can't go to the hospital, it's very expensive? Or, I mean, is that a story we should tell women?
There's a German proverb that says that anything that is you buy cheap will cost you twice. Meaning that when you run away from the cost of the hospital, at the tail end, you would come back to spend more. So we're telling them that go to the hospital. Find out what is wrong, even if you have to end at the level of consultation and detection by the hospital. At least you know what is wrong with you. And even they tell you, for example, people run away from HIV, hepatitis, cancer. They don't want to hear those words. So by the time the doctor tells you, you already have it at the back of your mind that something is wrong, rather than you having a pain and you treat for malaria and thinking that malaria was the issue. And then you keep treating for malaria like 6, 7 times when the actual problem is growing. If it was a cancer, it's spreading. If it was hepatitis, the viral load is increasing. If it was HIV, the viral load is increasing. So what we're telling them is, the moment you get the symptom at the early stage, go to the hospital.
Now, Dr. Gwet Bell, qu'est-ce qui pousse les femmes de ne pas aller trop à l'hôpital? C'est vrai que les femmes accouchent beaucoup, mais quand c'est leur santé, tu vois les femmes en train de bagarrer pour donner à manger à la famille, mais leur santé est donc la priorité ailleurs. Mais sur eux-mêmes, ce n'est pas la priorité.
Je pense que toutes les femmes ne font pas la même chose. Le premier problème, c'est d'abord les moyens financiers et le site où les femmes se trouvent, que ce soit en milieu rural, dans les villages ou dans les villes. Mais le problème financier est allégé par les États, par l'État du Cameroun également, en créant les hôpitaux à prix réduit, où la plupart des choses comme les vaccins, les accouchements ont des très petits prix, ou même on ne paye pas pour faire les accouchements. Il y a les accouchements qu'on fait maintenant dans le secteur public à 5 000 francs.
À combien?
5 000.
5 000 francs d'accouchement?
5 000 francs, mais c'est pas l'information ne passe pas.
Okay.
L'information ne passe
so
pas.
The problem is about communication here.
Yeah. Et aussi, il faut voir aussi que les actions du personnel médical ne sont pas toujours celles qu'on leur demande. Dans certains hôpitaux publics, on peut dire que l'accouchement est à 5 000 francs, mais finalement la femme va dépenser 30 000 francs ou 40 000 francs. C'est vrai que dans le secteur privé, on travaille régulièrement, mais les prix sont chers. Les prix sont chers.
Et ça pousse les femmes and it's pushing women away from hospitals.
C'est ça, de ne pas venir dans ce secteur parce qu'évidemment, le secteur privé, c'est les personnes qui investissent. Il n'y a pas de, ils prennent des crédits, ils ne sont pas, on ne tient pas compte qu'ils font de la médecine ou pas. Donc forcément, c'est cher et ça ne peut pas être accessible à tout le monde. Donc il faudrait commencer par la sensibilisation. Que les femmes sachent, les couples sachent dans chaque secteur ce qui est possible, évidemment d'aller dans le secteur qui leur convient. Maintenant, ceux qui travaillent dans les sociétés, qui ont les assurances, peuvent aller allègrement dans le secteur privé parce que la plupart des soins qu'ils font vont être remboursés ou ne seront payés par les assureurs.
I'm tempted to ask this question to Dr. Glory. At what time should a woman check on her health? Because women think that you must fall sick to go to the hospital. What is the frequency of that?
Annually.
Okay.
Annually. The check should be annually. And, you know, symptoms, Maureen, just to be very clear, symptoms like pain, headaches, bleeding, cramps will tend to push people to the hospital to seek for relief. So, for the females, with regards to all the physiological changes, I want to talk about the menstruation, maybe the menstrual cycle. Menstruation will come with cramps. Naturally, as a female, you will menstruate. And with some females will say, I don't experience menstrual cramps. But a majority of them, it will come with cramps, maybe a pain, maybe menorrhagia, excessive bleeding. And those things will tend to either give you a fatigue or cause you pain that will push you to the hospital. So in between these annual checks, in fact, there are aspects, health aspects like this that will push the female to the hospital. When it comes to the detection, early detection, like our sister said, and early detection of those chronic diseases that could have been managed earlier on, an annual check is very important, like the cervical cancer screening and the breasts. Equally, I wanted to highlight on one aspect that we have said here. We have had cases where the screening is free. We usually carry out some free
screening.
free
We don't see have women.
Yes, and these women come. Some of them you detect early enough. If, for example, if it's a precancer, cervical precancer, and you ask these women, we have to do a thermocoagulation. They will refuse. Like our sister had mentioned earlier, that there's a kind of fear factor. I don't know how to qualify it. I don't know if it's a stereotype, if it's environment. Talk less of the financial aspect. Some will have the finance to do that, but they will...
The fear factor is there.
Just fear. And we have had some cases where after maybe 1 year, 2 years, they are coming back now with a full-blown cervical cancer. And at that level, there's no more treatment. So in as much as there is the financial stress and burden, now we talk about the clandestine. Our assessment about this clandestine, you see someone having maybe a running temperature of 39 degrees, a headache and all of that, and they will go to start taking medications for malaria since we are in an endemic zone. Putting all of that together, or they'll call maybe a nurse at home to come and administer some drips because from the symptoms, they deciphered it could be this diagnosis. Now, putting all of that together, the little amounts that they have spent going round, which maybe at the end of the day accumulates and causes again more illness. You put all of that together, you find out that if they had taken this amount, just go to the hospital. First thing, you have to know what you are suffering from. It's not about just taking medications, because medications will have its own side effect that will aggravate your situation. First thing, what are you suffering from? Go for a lab test, get your diagnosis clear, and then you seek for medical attention. So I think that is a kind of misplaced priority financially.
All right. Now, the fear factor. Why the fear factor for women? You've seen a lot. You've gone through a lot. Why do you fear that stage? If you have to give birth, and you went through thick and thin to have a child, then why will you be afraid of knowing more about your health as a woman?
Well, it's the issue of being afraid of knowing about yourself, like we said. It's the fact that they're just like, how do I manage it after the diagnosis is done and I am tested positive, I'm declared a cancer patient? How do I live with it? That's so. I believe in our hospitals now we have counselors who are there to accompany the patients in such difficult health situations, and it has to start first of all with them. If a woman comes to the hospital, they should maybe first of all pass through a counselor before even going for consultation. If that is being done, she already knows, okay, if it's this is the next step. If it is that, this is the next step.
All right.
But I can tell you some doctors,
even some counselors do, they scare away women. The way you talk to the women, you just push them away. Don't you think the counseling and communications to go into churches, associations, and the rest of it, like trying to counsel women, tell them if you go to the hospital, it's about you, because women are the backbone of their families. Imagine a woman dies and leaves 5 children. What is going to happen to her kids? So by the time she check her health and she's healthy, those kids will also be fine. So don't you think that the counseling should be more, maybe they should go out? Should the counselor just sit in their hospitals and wait for the women to come, though they need to go out and talk to women?
I think that patient education is one of the things that have been greatly ignored in our society, because even at the level of dialysis, you would find a patient on the machine and they don't know why they're there, which they were supposed to be informed from consultation. Their family is supposed to know that this condition is going to run for this length of time. These are the things that should be expected. We don't do a lot of patient education, and we have myths, a lot of myths that people like Miss Eva said, that there are myths that are making people to be afraid. There are stories we've heard from childhood concerning health, like if you have this, you will die. Well, even if they died in the past, we now have solutions for these problems. So we need to actually go out. Like public health has to take it as a means of making caravans that go about to football fields in communities, because we have personnel that are not even employed. Another way that the government could employ some of these people that are looking for jobs is to make this campaign, train them, send them out into the communities. Let them tell people, pick a particular disease per time. Let people get the knowledge, what to be done, how to handle these things, because the reason they are afraid is lack of knowledge. Because people are afraid of what they don't know. But if they know that the solution is here and this can be done and this is the cost, people would run to the hospitals.
C'est ça.
Quand les enfants sont malades, c'est la femme.
C'est ça.
Everything rotates around the woman, but she's the last to go to the hospital. And that's what we are talking about here. Comment est-ce que la femme, a woman has to prioritize herself? That's what we are talking about here. You take care of others, but don't take care of yourself.
Si elle doit le faire, la femme doit être vaccinée, la femme doit suivre les campagnes, elle doit faire un peu. Il faut savoir, il y a les étapes. Les cancers, par exemple, les 2 cancers les plus fréquents chez nous, c'est le cancer du col de l'utérus et le cancer du sein. Et ces cancers sont évitables. Donc la femme doit palper ses seins tous les 2 mois, elle les palpe elle-même. Ensuite faire les mammographies dès qu'elle sent une boule, n'importe quoi dans son sein. Elle doit faire les tests de cancer du col de l'utérus au moins tous les 2 ans. Et dès qu'il y a quelque chose qui est détecté dans ce col-là, ça peut être traité rapidement et éviter d'arriver chez le cancer. Bon, elle ne doit pas faire que pour les autres, elle doit vraiment faire pour elle-même.
element. Yes, Dr. Gloria, we're talking about how should a woman prioritize her own health. You take care of your family, you take care of the husband. When your husband is sick, you sleep in the hospital with him. Your children are sick, you're in the hospital. Your mother is sick, you're in the hospital. But when you're sick, you don't check. And even when you're not sick, you're fine. You don't just go to the hospital to check. You're barely struggling. You continue struggling every day.
I mean, it's compulsory for the female due to the way God has created us. These changes, with these changes, we are bound to make sure that we keep the body intact. So the female folks, we are encouraged to do these yearly checks, maybe monthly checks, in order that we can stay healthy. If we are not healthy, we'll not be able to take care of the home. Because as Maureen rightly said, the home is largely on our hands.
All right, I'm looking at the case of rural women here, Evelyn. I'm looking at the case of buyer and seller. Look at their situation. How should they handle their health? Because she leave her home at 4 a.m., she return again at, let me say, 8 p.m. So, and then she goes, she does it every day, up and down. But sometimes her health is deteriorating, but she's barely struggling. She'll keep her money in the bank or put in one association, but she'll not want to go to the hospital.
That's really a complex situation. Bayam Salam, I'm talking with from experience because my mom is a Bayam Salam. Until she falls that she cannot leave the bed to go to the market. And that's when she's now taken to the hospital. We've even had times where it's at the market that we are called to come and take her to the hospital. They are so busy with the activities that they forget
about themselves. They bury themselves in the activities.
So it is now the place of, if it's an elderly woman who have grown-up children, for the children to see that they assist them to go in for these periodic checks. And we have our markets, they have managers also in the market who can meet with the health facilities to come to the market and talk to these women. Maybe come and even carry out some of those, some minor tests right there on the spot to help them. At first, those things were being done. I grew up in the market. Maybe I'm a bit crazy like this because I grew up in the market. I grew up in the market, Tarinko Market in Bamenda, if you know it. When we were young, we used to have people come to the market to talk to women, to talk to Bayam Salam, to even do vaccinations in the market, all those things. But those things are long lost in our country. We no more experience them. Maybe if some of these things come back, by the time they do it, maybe they have discovered something, but they will like push this woman now to come to the hospital, and then they'll give her the details of what she's suffering from. But to say she'll get up by herself and go to the market, it's only when she cannot get up and go to that market, now she'll think of going to the hospital.
A lot of women are taken away by their family, like my child's school fees, food on the table. You see, she's dying, but she's struggling, still struggling, even at that last minute to do something from the family. Dr. Gwet Bell, est-ce que c'est le problème de la femme qui vous a amené de faire cette in vitro au Cameroun, d'amener ça au Cameroun? Parce qu'il y a beaucoup de femmes aussi qui souffrent sans enfants, who don't have children, which is part of the health checks for women.
Oui, c'est sûr, c'est principalement les femmes, parce que dans nos coutumes, quand il n'y a pas de bébé possible, c'est d'abord la femme qui est discriminée. Donc nous avons, et puis les causes de l'infertilité en Afrique, dans nos pays, c'est surtout ce qu'on appelle les trompes bouchées. La plupart donc des femmes ont des trompes bouchées, elles ne sont pas au courant, elles ne savent pas, parce qu'elles n'ont pas fait les tests, comme on a dit, nous avons toutes dit. Et quand elles font ce test-là, quand elles faisaient ce test-là, évidemment, 70% avaient des trompes bouchées. Or, pour traiter les trompes bouchées, les médecins pratiquaient des méthodes inefficaces, notamment on faisait des hydrotubations, on faisait également la chirurgie, et les résultats de ce traitement n'étaient pas excellents. Et comme en 1978, est né le premier bébé éprouvette au monde, bon, nous nous sommes intéressés à voir aussi à capter cette technique. Et c'est comme ça qu'on a fait cette technique, on est reparti en Europe pour travailler, pour se former. Et c'est comme ça que nous sommes revenus, donc, avec la possibilité de faire ces techniques-là pour permettre à la majorité des femmes, à 50% des femmes qui ne pouvaient pas tomber enceintes, de pouvoir enfin tomber enceintes.
Mais c'est coûteux pour la femme.
Oui, c'est très...
It's very expensive because a lot of women want to have the babies, but some don't have the means to go through that means to have the babies.
C'est forcément très cher. Et pour l'instant, les États ne les subventionnent pas. Bon, le Cameroun a créé un centre. La première dame du Cameroun a créé un centre à Yaoundé, mais même dans ce centre, il faut payer parce qu'il y a des médicaments, il y a...
Ça coûte combien? On parle parce que les femmes doivent, because a woman can be dying out there, maybe she knows that it's $1 million. She can start saving her money and say, okay, that's my target for this year. I want to reach that target. I want to have my baby. I want to have, because it's part of the stress of women. And it's part, when we talk of women's health, it's that the reproductive part of women, that's the most essential part for women.
Oui, non, ce sont des techniques qui coûtent pas moins de 2 millions de francs CFA si tu mets les médicaments. Mais c'est surtout le succès, le taux de succès. Le taux de succès est élevé quand les femmes sont jeunes. Okay. Donc il faut que les femmes sachent toutes que dès que vous avez un problème, que vous voyez que vous ne pouvez pas tomber enceinte, il ne faut pas dire « Oh, j'ai fini d'abord les écoles » ou « Je me marie d'abord », toutes ces choses-là. Il faut
commencer à faire les bébés tôt.
Voilà, il faut commencer à faire les bébés tôt.
À quel âge, on parle de quel âge ici? 25 ans?
Oui, je pense qu'à 25 ans, les femmes devaient commencer à accoucher. Moi, j'ai accouché mes premiers bébés à 23 ans, donc je pense que, et j'allais à l'école. Donc je pense que l'école ne doit pas interdire aux femmes de faire les enfants. Ni le mariage d'ailleurs. Si on n'est pas marié, on peut faire son enfant.
And when you go through that process, is how many percentage? Because sometimes a woman might go through, but is it a 70% sure you have your baby when you pay such a large amount of money?
Oui, c'est comme je dis, c'est vraiment l'âge. L'âge est très important.
L'âge 50 ans, un peu plus? 50 years, you cannot go through that process?
On fait les enfants à 50 ans désormais, mais on passe par les dons d'ovocytes.
Parce que I know a lot of women they're out there, they've been married for maybe 10, 20, 30 years. They still hope, even at 50, you can have children. If you go through that stage, you just need to get the right practitioners to work with you, and you have the results of all that. Now, I want to ask MARYLYN, we're talking about healthy living, and I know March Fire Nation is so much engaged in healthy living. Now, what do you think, because besides going to the hospital, there are other natural things that women can do to live a healthy lifestyle? Now, what are those things?
Okay, Maureen, yes, March Fire Nation is really into healthy living. Like, we are very cautious about what we eat. How you start your morning will determine how the day goes. It's not just waking up in the morning and then taking one bowl of cassava and fufu, and you say because the day is going to be tough, so you need to feed yourself enough to, like, we have...
I don't want to cut it short, but our mothers in the village have been eating fufu and cassava, and they've been living for up to 50 years.
Yes.
Right?
At that time, they were eating the organic.
Okay.
They were eating the organic
That's
food.
why I wanted you to emphasize.
Yes, they were eating the organic. Now we have too much chemicals that have been put in our food. And we are in Cameroon, and most of us are living in our community where you have a little bit of ground around where you are. We even have vase now that people can plant inside containers. You can put your lettuce, you can put njama, whatever it is. But we have to think about ourselves. I think what we are taught in March Fire Nation is a warm cup of water with lemon in the morning boosts your metabolism. So that is, I'm waiting to see a March Fire member who has been there for 3 years that doesn't have that practice, because it is our culture. We have partners that we keep tabs on. Like, people post, you are like in our group, we are supposed to post your meals, like tell us what you have eaten for the day, and we assess it. Your plate will tell your neighbor and it will show. So because you have these accountability partners of what we eat per day, we usually think that when we talk of balanced diet, once you have eru with kanda and watafufu, the balance is the diet is
vegetable, right?
It is, but we have overcooked the eru. So the nutrients have died.
So what should we do with the arrow?
There is a way of cooking that will not be, let the greenness of your arrow still be visible, not dark. Let it not be the dark.
You don't leave it too much
you
on
don't
the
leave
fire,
it on the
right?
fire too much. You don't overstir and
leave
leave it on the
I'm
fire.
understanding it right now.
Yes, you don't overleave it on the fire. Let the greenness still be there, showing that the nutrients are still alive and it will still work in your body. So when we come to that conscious, even your njama, your bitter leaf, same. We need to, we think that when you look at the plate, when a white man presents his plate, you see a lot of things there and you think that they eat better than us. We have more than they have. We have fruits, but is that we're not brought up with the attitude of putting fruits at the same time with your food and eating together. We used to think that you would either eat the fruits before and then you come back after to come and eat your food.
Thank you so much. The cost of living today, does it permit women to live a healthy lifestyle, doctor? Cost of living today is very high. You see a housewife going to the market, you look at her list, she'll put cocoyams and the rest. Fruits is going to be at the tail end because she wants to feed the family, first.
Maureen, you can't refuse the financial aspect of it. Again, I think it's about the choices that we make.
Okay.
I
love that.
If we decide that we want to eat healthily, even with maybe 5,000, that can be possible. Now, you look at women, so you have to get your mesh. You see misplaced priorities. Sometimes they want
mesh
to
of 100,000 francs. You look at her watch, her jewelries.
Yes, they want to drink alcohol. Maybe the men, they want to prioritize some money for drinking, and they forget that they have to provide for the home, the fathers of the home. So it's about, I think that's about prioritizing and making good choices. Okay. The aspects of the nutrients, what you eat, it helps us equally to replenish and to prevent some of these diseases. Now, when we see how the women we migrate, we change from one stage to the next. Menopause is characterized by what we call osteoporosis. Osteoporosis is the kind of drain on the bones, and then there'll be pain. But if we know early enough that no, we have to consume some calcium,
things to prevent
to build
all those pain and
right. At this level, at this age, maybe 45, 55, or 60, 70, you may experience some of these changes, but you still find some mothers 70, 80, 90, they are up and doing those arthritic pains. So it's about this preventive, for me, it's about this preventive care. If you know what is correct for you,
and you start doing it now.
Start doing it now. I think that we're going to prevent a lot of these other complications that may come.
And we equally sampled the opinion of some women out there in the streets of Douala, Yaoundé, and the North region of Cameroon. We asked the women, how do you prioritize your health? How often do you go to the hospital? How often do you do your checks in order to stay healthy, take care of your family? Because women are the backbone of every family and every community. Let's watch. We'll be right back just after the jingle.
The woman is the heartbeat of a house. So if you don't take care of your heart, that means that you're dead. So don't be afraid of the hospital first, but don't wait at the moment you have to go to the hospital, to know that things are worse. So sometimes go and do some blood tests.
Prends soin de ma santé, je ne peux pas négliger ma santé. Soit en allant à l'hôpital si je suis malade, et puis j'évite aussi certaines nourritures que je peux manger, ça nuit mon organisme.
On prend ce qu'on a les moyens, on se débrouille, on se défend. On ne prend pas vraiment soin, parce qu'on n'a pas les moyens. Parce que ces enfants qu'on a payé l'école, ils ne font rien.
Bon, pour gérer ma santé, je m'abstiens de beaucoup de choses. Par exemple, mon alimentation. Et moi, je vais vous révéler que depuis que mon mari est mort, je n'ai pas de compagnon. C'est d'abord ça, pour les maladies vie. Et pour l'alimentation, je sais que par exemple, comme je suis ici, on a proposé le thé, le lait et le Nescafé. Sachant que quand je prends le Nescafé, ça me donne des insomnies. J'évite.
When you take care of your mental, there are so many things that you will avoid. In Africa, many women are having sad homes because they allow many stressful things to enter their heart and their mind. So before going to the hospital, avoid those things that will make you go there first.
Parce que ceux qui ne prennent pas, c'est pas manque de moyens aussi. C'est pas manque de moyens. Et le moyen veut dire quoi? Ce n'est pas toujours aller à l'hôpital. Il y a aussi des produits traditionnels qu'on peut prendre, ça nous aide, les herbes que nos grands-parents nous ont appris, et ça peut toujours nous aider.
Do your makeup as, you know, if you know how to do your makeup, pamper yourself. I think that's what I mean. Pamper yourself. Move yourself away from stress. Move yourself from people, you know, withdrawing your joy and your self-esteem. Because women, we are very sensitive. When a woman is sad or she's depressed, the entire house will be down. So do everything to feel happy.
And welcome back, Dr. Gwet Bell. We're talking about healthy living lifestyle. Qu'est-ce que la femme doit faire pour être en santé? Quelles sont les activités qu'elle doit emprunter pour être en santé? What are those activities that a woman should do to live a healthy lifestyle? How should she do it? How should she embrace it? Well, besides hospital, because we've talked about the hospital part of it, you need your check in the hospital and the rest. Now, beside the hospital part, what should she do?
Mais la femme doit reconnaître en fait quel est le centre de la famille. C'est-à-dire assurer une bonne alimentation pour la famille, de préférence des produits naturels, éviter tous ces produits vendus dans des mauvaises conditions.
Est-ce que c'est ce que toi tu fais?
J'essaye de le faire. J'essaye de le faire, mais comme j'ai pas beaucoup de temps, j'utilise des cuisinières.
Ok, parce que beaucoup de femmes ont dit aux femmes, they tell women that you can do your food, put it in your bag and go to work. Because when you're cooking your own food, there are a lot of things you eliminate. You don't put so much oil, you don't put so much salt. I mean, you're taking care of your health. C'est ça qu'on fait, n'est-ce pas, donc?
C'est ça. Mais il faut, même si on utilise les cuisinières, il faut leur dire ce qu'il faut faire. Il faut leur expliquer d'éviter beaucoup d'huile, beaucoup de sel. Et ça peut aider pour tout le monde.
Et quand on est dehors, qu'est-ce qu'on fait? Si tu n'es pas à un mariage, tu n'es pas désordonné, quoi.
Oui, non, mais quand tu es invité, ce n'est pas le moment de manger tout. Il faut continuer à manger léger, c'est vrai. Il ne faut pas faire la gourmandise pendant les invitations, mais surtout, il faut informer les enfants. Quand ils vont à l'école, il faut leur donner de quoi manger, un fruit, les fruits naturels, puis de l'eau. Ça peut les aider.
Mais la vie est coûteuse au Cameroun aujourd'hui. Is it possible for a family because you want to cook a good pot of euro, at least 5,000 francs?
Oui.
Just euro. Then, if you want to add fruits, it means that for a family of 5, you're spending like 10,000 francs just a day. Is it possible?
No. No, je pense que...
I know Maryly is itching to talk there. Just wait. Yes, Doc?
Non, on peut leur donner des choses qui ne coûtent pas.
Okay, il y a les fruits qui ne coûtent pas trop. You have fruits that are seasonal fruits that you can go more for them. Even vegetables that are seasonal, you go more for them rather than go for foods that are expensive, right? Evelyn.
To eat seasonal fruits. Like if you really want to consume fruits, make your priorities of your fruits when they are in the season. If it's season for watermelon, eat more of watermelon. If it's season for pineapple, eat more pineapple. If it's season for mangoes, eat more mangoes. But you cannot, if you don't have the means, it's a season for mangoes and you want to go and start eating watermelon, how much would you buy one watermelon? It will be expensive for you. So that's the best way. And then we have for the vegetables. Yeah, vegetables are not really very seasonal, but we have vegetables that are cheaper. Like if you want to cook vegetable and you know bitter leaf will be cheaper and much to feed the whole family. Why would you want to go for okongobong when you know you buy just a bit of okongobong to feed your whole family? Go for bitter leaf. You cook a whole pot of bitter leaf that the whole family will eat and be satisfied.
And that's going to make the family to live healthy.
Healthy.
And it's going to be difficult for them to go to the hospital as well, right, Dr. Glory? Because when you eat, you have healthy meals. And then who does the healthy meals for the family? It's a housewife. It's a woman that's at the center of everything. Now, Evelyn, let's talk about a little bit of MASH Fire Nation. I think you've been at the organization for close to 10 years now, right? And what pushed you and what are the benefits after joining? Has it been able to make you to live that strict, healthy living lifestyle? What about sports? How often do you do sports or exercising?
You just got me there. Okay, I've been a member of MASH Fire Nation since its creation. We started with Shape My Body Fitness. That was how we started. We were just struggling to shape our body. We realized at the age of 40 and above, the shape was getting out of its place, and we really wanted to get it back in shape. So we started with Shape My Body Fitness.
There's not only about shape, because when you're doing the shape, the body needs to be healthy inside as well.
Yeah, that's true. You're right. Because when we started working on the shape, we saw the glow of the body coming out. Because I stayed for like 6 months without eating white bread.
Wow.
And it was unlike me, you know. So MASH Fire Nation has shaped the way I think, the way I live. It's not like we don't cheat at times. We can cheat, but when I cheat, I know what to do the next day. I have some of my friends who ask me, is your body elastic? Like, we see you this month, you are fat. We want to see you next month, you're because I already know what to do. It's a lifestyle. It is inside me. I've inbuilt it in me. If they place me in between some of my friends or my sisters, they will think I am 20 years younger than them. Meanwhile, I am 15 years older than them. That's the truth.
Because of the healthy living lifestyle you have embraced, right?
There are things I will not touch. There are things I will eat, but I know what to do the very next day or the very next 2 days.
You're eating and you're burning, right?
Yes.
So
I'm doing exercise or I am consuming some foods that will flush away those bad nutrients from my system.
All right. This has been impactful not only to you, but to, thousands of women in Cameroon, hundreds, because you have sessions, right?
Yeah.
Where you impact women, you educate women, you try to change your mindset, and they see you doing it because you post on Facebook, right?
Yeah, and even people staying beside me, some have started copying some of those things that I've been doing. Like, you come to my kitchen, you've never lacked cinnamon in my kitchen, you will not lack clove in my kitchen, ginger. There are some of these things, my fridge, cucumber, yeah. So some of them have started copying, and they are also seeing the benefits of it, and they are living by it. They must not join MASH Fire Nation to be
but they should
to live the healthy lifestyle. But when they see you doing it and they are seeing it, how it impacts you, how it's showing in your body, they will copy.
All right. Thank you so much, Dr. Glory. How do we encourage women to live this healthy lifestyle? Because it's not easy to wake up in the morning and do sports. Yeah. Where do you start from? Do you do sports? Let me start from there.
Yes, Maureen, to be very, very practical with you. Sometimes I get so overwhelmed by the work, by patient load. I realize sometimes even to sleep, I don't have time even to sleep. And late, I realized that I started experiencing some arthritic pain at the level of my waist and my knee. And I said, because I used to do a lot of sports even before I went to Q's. But while the activities are just so enormous, overwhelming, that you hardly squeeze time to even go jogging in the morning. And when I started experiencing that, I decided to go to Paco Vita, to go back to my old gyms. And behold, the day I undertook that venture, I did my gymnastics and I came back. I was really relieved, and till date, I no more feel those arthritic pains. So what are we saying here? Practically, the women, yes, will have a lot to do. Those buy and sellers who go to bed at maybe 10 p.m. and they have to be awake by 2 a.m. and you think that you want to make the world's money. Even the richest person is still looking for that money. There are women who die, just as our sister was saying, on the way. Maybe they have gone to maybe Pernambuco to do some marketing, those by women, and they are on the way in the vehicle, and coming back, heading for Douala, and some of them, they give up the ghost along the... So what are we saying here? We are encouraging the women that you have your time to live. You have the little time that God has given us to live. Let's exploit it so that we can be healthy and do meaningful contributions to the environment. Yes, those buy and sellers, they go to get food to come and feed the city, but equally you have to stay strong and healthy in order that you can do that for a longer while. So physical activity is very important. Sleep hygiene is very, very vital. Now, I received some mothers who come who are buy and sellers. They go to bed 10 p.m. They want to get up at 2 a.m. or 3 a.m. for the market. They say, no, if I don't go at this time, I'll not be able to get it. And they are hypertensive. All the time, the blood pressure is up. Some are diabetic. They don't take care of their feeding. So we are encouraging all our sisters out there. It's true that this show is for sisters. The men should not say we've left them out. It's for sisters because of the way God has created us. Because we have to accommodate those changes. Yes, we have to accommodate those changes. Please find time to do your exercises. Find time to sleep. Find time to relax. Stress, because stress alone can sap even the money you think that you're out there chasing. So please find time to relax, distress yourself in order to get this good living. Now about alcohol. Alcoholic percentage equal. You find some women, they go out there struggling, and at the end of the day, they squander this money in alcoholic consumption. So you see the prioritization and the choices that we have said here.
Thank you so much.
If these amounts can be used to curb and to make these meaningful aspects of our lives, I think that the women will really be in good health.
Thank you so much, Doug. Now I want to go back to MARYLYN. 10 years of your organization, March for Nation. 10 years of doing what exactly? What are some of the activities you've done concretely? And 10 years, what do you intend to do after this?
Okay, so for our 10 years, we've had 10 years of visiting schools, like having talks to children about drug abuse. Like, we're very always sensitive about what is the crisis at the time. So if we have cases of abuse, we would go out and sensitize women how signs and symptoms, if you are being abused, what to do, who to talk to, who to meet. Like, have somebody that you trust enough to tell them that this is what is happening to you. Get friends that are close enough to you, someone you can cry out to. We go to orphanages, we do a lot of things. We reach out to the population depending on what is the crisis internationally as per time. If there is a topic that hits and we see that it is going to affect, like other societies are complaining, we find opportunities to meet people, meet women, meet children, go to institutions and sensitize them about these issues so that we get a better world. That's just what Marchfire is all about.
All right, thank you so much. And Dr. Gwet Bell, we are gradually rounding off the program. But now, what advice, what will you tell the women if they have to come to your hospital, meet gynecologists like you? What do you tell them? What's the motivation? How do you motivate them to come towards you?
Je pense déjà que par l'éducation, par les sensibilisations, aussi en leur mettant des locaux agréables où elles peuvent venir, pas uniquement pour faire la médecine, mais aussi pour faire les sensibilisations. Qu'elles puissent répéter cela dans leurs réunions de famille et entraîner toutes les autres femmes pour vraiment faire des pratiques qui apportent la santé. J'ai bien écouté, par exemple, le sport. Elles n'ont jamais beaucoup de temps pour faire le sport. Mais on peut faire le sport en marchant, ensemble, en petit groupe. Elles peuvent également...
Marcher pour aller même au marché, n'est-ce pas? Si tu as le pont, tu peux faire la marche à 6h, 7h, tu es au marché.
Absolument.
But I'll add that modernization has killed our exercises. Our parents lived longer because they used to trek. Trekking was the means of transportation and their bodies were exercising in those processes. But now bikes are everywhere. You just San Fran, you have jumped, even a distance that you can walk for 5 minutes, you're already at San Fran, and that's how you're killing yourself not knowing. Let's learn to walk. Just take a walk. We have like Marshfire June walk. We're walking the whole of June, counting our steps. That is how we keep ourselves motivated.
All right, Doc?
Oui, donc c'est ça la marche, on l'a dit. L'alimentation, on l'a dit également. Mais aussi le travail de groupe. Les femmes doivent continuer à avoir des relations en matière de... on peut parler des tontines, mais pas forcément se rencontrer pour même dans l'église, même quand elles sont dans l'église, il faut toujours qu'elles fassent des groupes pour pouvoir partager les connaissances et surtout partager les pratiques qui sont positives et qui ne coûtent pas de l'argent.
Okay, mais il y a aussi cette vaccin. There are vaccines for
vaccin.
young girls that mothers are preventing even their girl children from taking the vaccines. And the vaccines are wasting. The vaccines are there. Girls between 9 and 14?
15.
13 or 14 or 15
15.
are supposed to take the vaccine to prevent in the future cervical cancer.
Yeah.
But the situation on the ground is bad because statistics show that the vaccines, the girl children are not taking that vaccine because mothers don't even, so mothers have this idea like the vaccine will prevent their children from having children in the future. So I want you to give us clarity on that. I think Dr. Dory will do the same in English.
Oui, alors la vaccination, on va parler de notre pays contre le cancer du col de l'utérus, parce que le cancer du col de l'utérus est provoqué par un virus, HPV. Donc si la vaccination des enfants est gratuite, de 5 ans...
It's free.
Oui, de 5 ans à 12 ans. Au-delà, à partir de 15 ans, vous allez payer. Mais même ce qu'on paye n'est pas important. Donc toutes les filles devaient être vaccinées contre ce virus-là. C'est déterminant. Si on est vacciné, on ne peut pas faire ce cancer.
Okay.
Et ça, c'est clair.
And it's going to prevent the cancer if the children take this. Will not have a lot of people being affected in their older ages, right, Dr. Glory? I just want you to add on that, emphasize on that.
Yes. The human papilloma virus, usually the government launches the campaign for this age group to come for the vaccine. So it's a matter of the myth again. The myth. People just believe those wrongful belief patterns. Yes, sometimes they can get it that they were vaccinated somewhere and this is what happened. But the practice is that it prevents one from contracting these diseases. The pre-cancer, for those that we have been diagnosing, Maureen, you'll be very surprised that the age group, we have more of between 20 years and 29 years.
Jesus.
We hardly have pre-cancer in elderly women.
Yeah.
Now, we even had one 19 years, already pre-cancer of the cervix. So I think that is a huge call for concern that our children, those who have not yet started sexual activities, because once you're already sexually active, the chance is maybe that you might have already contracted. But our female children who are not yet sexually active should be vaccinated.
All right. Thank you so much. We're rounding up. I would like Evelyn to look at her camera the other way. You're talking to a woman out there.
Okay, thanks, Maureen. I will tell every woman out there, being you a career woman or a business woman, to take care of your health. Let your health be your priority. Let your health be your priority because you are the pillar of your home. So, prioritizing your health First is by doing your routine checks. If you have a small symptom in your body, take yourself to the hospital. The hospital is the best place to tell you what is going wrong with you. Healthy eating life, healthy living, how you eat, what you eat is also very, very, very important.
Okay.
Not because you see food in front of you means you have to eat everything you have seen in front of you. You can pick, you can select what is healthy and you eat to nourish your body.
All right, thank you so much, Dr. Gloria. Look at the camera in front of you. You're talking to women out there.
We encourage all the women to take care of their reproductive health, take care of their mental health, take care of their physical health, emotional health, social health, spiritual health, by carrying out annual checks with a gynaecologist or physical exams in the hospital, eating healthy, so that we can stay longer and accomplish what we have come on earth equally to accomplish.
Thank you so much, Dr. Gwet Bell. Votre caméra est directement devant vous. Je veux que vous parlez aux femmes qui vous regardent. Peut-être c'est un conseil, je ne sais pas ce que vous voulez dire à une femme ou les femmes qui vous regardent à l'instant.
Ben, je salue toutes les femmes, je leur dis de continuer à travailler comme elles le font, c'est-à-dire travailler pour la famille. Mais ce travail consiste de faire un peu d'éducation physique, de marcher, de manger correctement, d'éviter les nourritures qui ne sont pas bonnes. Et côté santé, qu'elles fassent de la prévention pour elles et surtout pour les enfants, pour leur mari. Ça passe par les vaccinations. Surtout, il y a chez nous les deux cancers les plus fréquents, c'est le cancer du col de l'utérus et le cancer du sang. Ces deux cancers sont évitables. Donc, il faut encourager elles-mêmes et surtout les enfants, les femmes, les filles à procéder à ces vaccinations-là. Et dès qu'il y a le moindre problème, il faut aller à l'hôpital.
Marylyn, you're listening, your camera is right in front of you. You're talking to a woman out there.
All right. To anyone out there, young girl, middle age, old age that is listening, your body is the temple of the Lord and you need to keep it well. The fact that you're young now doesn't mean that you don't get old. What you put inside your body is what it will become tomorrow. Your body is a machine that needs to be maintained. So it is what you eat, what you do with that body. Feed well, exercise well, and you would have a good body at your later age.
And I want to also say that the founder of March for Our Nation is
A Cameroonian?
Is a Cameroonian. Where she based?
America.
Maybe we
She's
should
in the
know
US.
is she a Cameroonian, because a Cameroonian having the idea of making women to have a healthy living lifestyle, that is we need to applaud it, right?
Yes,
Can we
she's a
know her name?
Cameroonian.
Can we
She
know?
is called Anna Formoso, aka Coach K, and she's based in the US. She's in Oklahoma, in Shawnee, and she is a die-hearted Cameroonian. She visits from time to time. She's always here to see how things are happening back in the country, and she pays attention to what is happening in
I want to say a big shout out to K for all what you're doing. A big shout out to Coach K for all what you're doing to empower our women, ensuring that they embrace this healthy lifestyle. I mean, the charitable works. I mean, empowering young girls. I mean, just putting smiles on the faces of women. That's what we're talking about, living healthy. Because if you want to live a healthy lifestyle, it means you need to be positive. You need to just smile, have that broad smile, and you continue working. Now, I have Dr. Gwet. The book is right here before me. This is the last publication, the most recent publication, because you have other publications, right, Doc? Doc, now she's going to like sign here for me, right? Life, I want you to do it right now. And we've come to the end of this edition of Women and Leadership on Canal International. We're talking about women and healthy living lifestyle. I'm sure you enjoy the program, and I'm sure you learned something that is eventually going to change your mindset and your way of doing things. Thank you so much for watching, and bye-bye from us, the studio. Thank you.